There are not enough stroke specialists in the United States. Stroke is the fifth leading cause of death. It's one of the leading causes of morbidity, especially preventable morbidity. And the thing about stroke is that there are very effective treatments. There's very effective interventions for when people come in with stroke.
But they are time sensitive, and we can only do them within a certain amount of time to be able to reverse the effects of stroke. You know, we have to face the reality that there is healthcare disparity by race, by gender, and rural versus urban.
And our mission has always been that it's not fair to receive different levels of stroke care depending upon where you live.
If you live in rural area where you're so far away and you go to a hospital that is not connected with Telestroke, then you might not get as high quality of care.
The majority of stroke treatment is really cerebral. It's interpretation of imaging, it's education of patients, and interpretation of labs. It's getting a history from the patient and doing an exam. And all of that can be done over Telestroke.
Telestroke is this wonderful new technology that we are now able to see stroke patients in emergency rooms wherever they are.
What we've realized is that we really don't need to transfer these patients, and that the majority of them, probably 75 to 80% of patients really can be managed in their own community and with their families without having to travel long distances to see a stroke specialist.
So Telestroke is being able to, through telemedicine, through teleconferencing, with a computer and a Telestroke cart in the emergency room, we can do a full stroke assessment without being there physically. We can also make decisions and avoid an unnecessary transfer.
We're also unique in that we primarily operate with the attendings the inpatient telestroke rounding at other hospitals, which is a program where we are actually using telestroke technology, telemedicine, to round at hospitals that are in more distant parts of Minnesota to allow them to have a stroke provider to see them where there wasn't previously any stroke provider access at these hospitals.
Studies have shown that when hospitals are aligned with a comprehensive stroke center and stroke specialists that see patients on Telestroke, that their rates of mortality and morbidity are down really just based on Telestroke alone and that intervention that it provides.
One of the advantages of our program is our robust advanced practice provider team. We're a group of nurse practitioners and physician assistants who really help to extend the reach of the stroke program.
You know, we are physically present in 2 hospitals, the 2 comprehensive stroke centers, and then we have 7 other hospitals that we can see all the stroke patients there with the telemedicine technologies.
We answer stroke codes both here at Southdale, we work in the ICU and on the floors, as well as answering stroke codes and responding to these acute activations at Fairview hospitals all over the state of Minnesota.
All of these emergency departments have stroke specialist coverage 24/7. Our goal is to do comprehensive care as a system, not comprehensive care as an individual stroke center.
We can provide equivalent quality of care to our rural patients, and that wasn't possible before Telestroke.
To be able to provide that level of care is really gratifying and essential.